Hi, my name is Elizabeth Mason. I'm a lecturer and academic in the School of Health Sciences at Bangor University. And I came into nursing as a mature student, although a lot younger than I am now. And I think what inspired me to come into nursing was a person who I was very close to when I was very young. And she went from being a milk lady to being an old registered general nurse. And I can remember her studying and thinking, I want to do that as well. And it just absolutely fascinated me seeing, all of the books and things that she was reading and learning about how the body works. So I think that was my inspiration. If I was talking to my younger self or thinking about my younger self, I think I would have paid more attention to what people were saying to me at school and sort of trying to help and direct me in terms of my career. And then I wouldn't have had to leave it so late to come into nursing, because I'd have had my exams and things in the bag and not had to go off and do an access to health course before I could come into nursing. So I think listening to the advice that people give you, because it is well meant and it is there to help and support you. And there's lots of advice available to people who are considering different careers in nursing. A good applicant for me is somebody who has really done their homework. So they've had a look at all of the career sites, where they've had a look at the Nursing and Midwifery Council, the Royal College of Nursing websites. They've talked to people, and they've done their homework essentially about finding out what a registered nurse is, what makes a difference between a registered nurse and, for example, a healthcare assistant, and also the fields of nursing, so that they understand what is the difference between the four fields of nursing, and they can give examples of, within their application, that they can talk about those sort of core values that we think about, the 6 C's. But not just that, when you're looking at a really good applicant or a really good application, it just shines out because they've used examples to demonstrate. They haven't just told me that they're kind and they're caring. They've used examples to say, I can demonstrate that I'm a kind and caring person because, and they'll give you examples, obviously within the word limit of their personal statements, but they can give examples of what those words actually mean. And you don't have this sort of tautological dialogue about, well, I'm a kind and caring person, so I'm compassionate. And what's compassion? Well, it's being caring. So they're able to actually understand that terminology as well and use examples for it. In Wales, we have the All Wales principles for recruiting for our nursing programme, so the universities in Wales, and I lead the All Wales admissions group. And we share these common ideas of what we're looking for. In Wales, of course, we have our numbers are recruited by Health Education Improvement Wales, so it's a slightly different system to that takes place in England and certainly in Scotland, because our numbers are commissioned by Welsh Government through Manforce planning, or future planning for the health boards across Wales. So our numbers are commissioned, but also, of course, we've still got the NHS funding, which again is very different to funding, particularly in England. I would ask people about, have they been a peer guide in school? Have they done reading support? Have they been a prefect? If those kinds of roles still exist. Have they done Duke of Edinburgh Award? So all of the things that people have done through their schoolings, through their secondary schooling, can be used as examples, whether they've been in the Brownies or Girl Guides, those kind of things they can use as examples to show their qualities and values. And I think that's really important. And I think one of the things that the current situation around COVID-19 has done has been to limit the care experience that people can have. So for me, it's much better to draw on examples that are sustained, because then you can use them as well to show things like your commitment and your resilience as well, which is a really big thing for nursing, resilience. So if you can talk about how maybe, even if you've worked part-time, so you've worked in a local supermarket or you've worked in somewhere like McDonald's. There's all sorts of things that you can draw out of those examples to demonstrate teamwork and communication. So many things that you can draw on without necessarily having that care experience, which is really hard to get at the moment. I think for me, I had a cohort of students, personal tutees, who completed in April, and just seeing them get through the fact, they had worked so hard in very difficult circumstances, and you just feel so proud of them. It's their hard work, and it's just that feeling that you get of absolute pride, and you couldn't be more proud of, if they were one of your own children, I think. And in fact, I sort of went out for my first sort of post-COVID drink on Friday, and I bumped into an old student, and she was telling me about her career, and I think she graduated about 10 years ago. And it was just fascinating hearing, her career trajectory since she's qualified. So, those students who come in as newbies, and they're frightened, and they've got all of the same worries as Anna's just explained, and that they work through them and they persevere. Some can take a little bit longer than others, but that they actually get through, and you just feel so proud of them. And I think one of the reasons I went from nursing into nurse education was to have a stronger influence on the quality of patient care. And for me, I see that through the students who we see graduating. So it's just, I just feel immensely proud of being a nurse and being able to be a small part of them being the future generation of nurses. Nursing is an academic qualification. Yes, it's 50% theory, 50% practice. And I think it is one of the toughest degrees that you could do, because you are actually combining theory and practice. So you're applying this theory to patient care. And if you start to count up the number of subjects that you would actually cover as part of a nursing degree, it's a very broad degree, so just totting up now in my mind, you'd think about 10 different subjects that you would cover probably in years 1 and 2. So for me, I think for a mature applicant, don't be put off by thinking, oh, I've got to go to college first. 60% of all access to HE learners are doing a health related course. So access to HE is a fantastic provision, because some of the entry requirements are stipulated by the Nursing and Midwifery Council. So we have to have evidence of numeracy, evidence of literacy, and digital and IT technology capabilities. And you have to have your level 3, in most cases, entry qualifications. So thinking about going to college, doing a qualification, really does set you up to be successful on a nursing course. I think, even if you have maybe done A-levels in the past, and then you've gone away, you've done other roles, you've maybe had a family, it's very worth spending that time first, doing either, the first part of a foundation degree or access to HE, so that you can prepare yourself to come in to do your nursing degree, and you're really well prepared, you've got the study skills, and you've developed your confidence as well, because I think that's what the issue is for a lot of mature learners, is confidence. I think, when it's, I don't know if it's particularly maybe a female thing, if I'm allowed to say this, it's you're at home, you're with children, and it does sap away your confidence, and you forget about being out there and being, working. Maybe you're doing part-time roles. So doing something like that, build your confidence, go to the open days, go in and talk to people, think about, what it means to you. I think that's one of the most important things as well, is having a really good plan, so, mature students tend to have other responsibilities, competing responsibilities. So, get a good plan in place as well. I think remembering that you are going for an interview, yes, it's a higher education course, but essentially, it's almost like a quasi interview for entry into your profession. And to remember that part of the selection process may be undertaken with service users and carers, and also health NHS trust staff. So think about how you're going to Obviously you've done your preparation, as Lauren says, but think about how you're going to present yourself, that you are going to present as if attending for a formal interview, and that you've, you know, paid attention to how you're going to present yourself in terms of dress and everything else. So not looking as though you're going for a night out essentially, but it is a professional interview. Most universities will have a little bit of wriggle room around grades. So, you know, if say your predicted grades are 120 UCAS points and you drop down slightly, maybe you get BBC, which is about 112 UCAS points, you know, they may well still consider you. I think if not, if you have maybe not attained the grades that you were expecting or close to it, then you could consider maybe doing a different undergraduate degree, certainly for the first year, and then maybe asking for a change of degree within the university or reapplying. I don't know if you probably couldn't come back through UCAS, but you know, there are different ways of coming in. Certainly at Bangor, what we will do is we will offer a different undergraduate degree, and then if you're successful in year one, we will then look at you know, taking you then into year one of the Bachelor of Nursing programme. The other option is, and I think it's one that seems a little bit daunting, but if you're not successful for your nursing degree, you may well be successful for doing something like sociology or psychology, where the UCAS points may be lower. And you could do a 3-year undergraduate degree, and what the provision that is increasing are MSCs or pre-registration MSc programs. And I think that that's a really good way of coming, you know, into nursing as well. So, you know, there's not just one way, even if we're not talking about like the nursing associates or the nursing apprenticeships in Wales, there are other things you can do. Obviously, you know, if you didn't meet your grades, for us, it wouldn't be worth you coming back through clearing. You would have to go into maybe another course and maybe then try for nursing the following year. But I think the most important thing is talk to people and don't give up. If that is what you really want to do, then, you know, really find a way of doing it. And that really counts in your favour, because what you're demonstrating then is commitment, which is one of the 6 C's, but also resilience, that you can bounce back from a disappointment and you can find a new way of, you know, moving forward to come into nursing. So just don't give up. I think for me, what makes a really good applicant, there's 3 things. There's the qualities and values, there's that intelligence, and then there's the common sense. And if you put all of those together, what you're looking at is intelligent kindness, and that is what underpins nursing practice. So a good tip there, have a look about emotional intelligence and intelligent kindness.